Hi, this is Andrew Wolf. In this video, I'm going to talk about oncologic emergencies. Now, if you remember, when we talked about the effects of cancer on patients, we talked about sort of 5 underlying causes of the commonly seen effects of cancer, and those included the aberrant proteins that are produced and synthesized by mutated cancer cells, the increased metabolism from the rapidly dividing cancer cells, the body's immune response to the cancer, the mass effect from the tumor or the fluid secreted by that tumor, or the treatment side effects. Now, with oncologic emergencies, really sort of 3 of these effects are involved. Now, the aberrant proteins have a very significant involvement in oncologic emergencies. So in particular, these are responsible for what are known as the paraneoplastic syndromes. And paraneoplastic syndromes are, sort of a whole host of syndromes that are caused by these aberrant proteins that float around in the bloodstream and sort of wreak havoc in the body because these proteins are mimicking hormones or even in some cases neurotransmitters. Now, the aberrant proteins can also lead to issues with hypercoagulable states. And again, some of the proteins involved here with the paraneoplastic syndromes are sort of things that look like hormones. So, it can cause syndrome of inappropriate antidiuretic hormone, or it can cause hypercalcemia due to parathyroid-like hormones. And hypercoagulable states are caused by proteins like tissue factor that are produced by tumors and mutated cancer cells. Now, the second major issue that causes oncologic emergencies is mass effect. And again, this can be the effect of a growing tumor itself, or the fluids that it secretes, or the bleeding that this causes. And examples of this would include tamponade, when there is fluid that's accumulating in the pericardial sac and compressing the chambers of the heart, and it can cause spinal cord compression when you have a mass that's compressing in on the spinal cord. Another example is superior vena cava syndrome, or SVC syndrome. Okay, and then the third major cause of oncologic emergencies are due to treatment side effects. And really the most significant oncologic emergency due to treatment side effect would be neutropenic fevers. And infections due to neutropenia and the immunosuppression that's caused by neutropenia is the #1 cause of death for cancer patients. So really, of all of the oncologic emergencies that we're going to talk about here, this is the one that is most likely to lead to the death of patients. Okay, so after this video, I'm going to make a brief series of 7 videos in which I'm going to talk about some of the most significant oncologic emergencies. And in particular, I'm going to talk about, for the ones that are related to aberrant proteins, I'm going to talk about hypercalcemia, and ones related to changes in coagulation. I'm going to talk about pulmonary embolism. And then on the flip side of that, I'm going to talk about disseminated intravascular coagulation, which is actually a state of hypocoagulability. And then I'm going to talk about all of the issues here that I mentioned from emergencies that are caused by mass effect, tamponade, spinal cord compression, SVC syndrome, and And then last, I will talk about neutropenic fevers. Okay, so I will see you in some of those videos coming up.